Hello, and welcome to the Center for Disaster Philanthropy webinar, Older Adults and Disasters, Overcoming Stereotypes and Strengthening Inclusion. My name is Austin Snowbarger, and I am the Manager of Learning and Partnerships at the Center for Disaster Philanthropy. My pronouns are he, him, his. A couple of things about myself and where I sit in this space and discussion. My professional experience and interests include the intersection of older adults and disaster. Prior to joining CDP, I worked at Next 50 Initiative, a private foundation dedicated to funding mission-driven initiatives that improve the lives of the older adult population and their caregivers. Previously, I have also contributed to research outputs for the Age and Disability Capacity Building Program, led by HelpAge International, that aim to ensure older adults and people with disabilities are included during emergency responses. Some housekeeping notes before we get started. You can submit questions at any time using the Q&A box at the bottom of your screen, and we will answer them at the end of the panel presentation. If you are on Twitter, please use hashtag CDP4Recovery, that's CDP, the number 4, recovery, to share and join the discussion. And don't forget to follow us at Funds for Disaster. At the end of the webinar, there will be a short survey. Please complete this to help us improve our webinar offerings to better meet your needs. And finally, we are recording this webinar. It will be available on our website and YouTube channel shortly after the webinar is complete. Live captioning is available now via Zoom. Click on Closed Caption, Live Transcript to access it. More accurate captions in the recording. This webinar is co-sponsored by Giving Compass, Grantmakers in Aging, and United Philanthropy Forum. We thank them all for their support. As we begin the webinar, CDP acknowledges it works on the stolen lands of the many original peoples. We recognize that Indigenous peoples have been displaced and disenfranchised from their land by the socioeconomic and cultural impacts of colonialism and disasters. The erasure of Indigenous knowledge about how to care for these lands has caused environmental destruction and degradation. CDP is committed to dismantling the ongoing legacies, systems, and structures of settler colonialism and white supremacy, and their connections to philanthropy, today and in the future. Despite centuries of theft, violence, and murder, this is still and always will be Indigenous land. Please join us in acknowledging the original peoples and their elders, and past, present, and future generations. At the end of the webinar, funders will understand the diverse experiences of older adults and how to combat stereotypes, learn about considerations for supporting recovery for older adults in disasters and humanitarian crises, and finally, know how to ensure financial support improves access and strengthens inclusion for older adults before, during, and after disasters and humanitarian crises. So let's take a look at the results of the poll that many of you participated in at the beginning. We wanted to gauge, who's in the room and see the level of awareness that all of you have with this topic. And it's good to see, more than 50%, most of you are aware of the older adults experience, disasters, humanitarian emergencies, and others across the spectrum. And welcome to all of you. And we think the content that our panelists will bring today and the learnings they'll share with us will be relevant for all of us. Now it is my honor to introduce our very special guests. I am looking forward to the information that they will share with us. Carol Agingo is the Global Initiatives Lead and Africa Regional Representative at HelpAge International. She leads in policy advocacy for the rights of older persons in Africa and linking this to strategic initiatives at the global level for greater impact. Prior to joining HelpAge International, she was the Associate Regional Director for Policy and Advocacy at Planned Parenthood Global and was previously the Senior Program Officer for Africa at the International Women's Program of the Open Society Foundations. Jeffrey Lambert serves as Chief Operating Officer of the Ventura County Community Foundation. As Chief Operating Officer, Jeffrey leads the Development and Stewardship Division, Program and Grants Department, Marketing and Communications, and Strategic Initiatives. Prior to joining VCCF, Jeffrey served as Community Development Director for the City of Oxnard and the City of Ventura. And last but certainly not least, we have Dr. Ninia Campbell, who is the Deputy Director of the Bill Anderson Fund and a Research Associate with the Natural Hazards Center at the University of Colorado Boulder. Her research centers on the intersections between disaster vulnerability and resilience among older adults and historically marginalized communities, with an emphasis on inclusive engagement. Welcome to each of you, and thank you for taking the time to share your expertise with us. First, to quickly set the stage a little bit for this discussion, May is Older Americans Month here in the United States, and this year's theme is Aging Unbound, which includes how we all benefit when older adults remain engaged, independent, and included. There's not a universally agreed upon definition of older adults. An older person is defined by the United Nations as a person who is over 60 years of age. The World Health Organization says between 2015 and 2050, the proportion of the world's population over 60 will nearly double. In the United States, people aged 65 plus represented 17% of the population in 2020. That is expected to grow to 22% by 2040. And our panelists today will share how philanthropy can reduce barriers to access for this growing population and support their inclusion in planning for and responding to disasters and humanitarian emergencies. So I'm looking forward to this discussion. Let's get straight to it. To begin, let's please start with you, Ninia. What does the research on older adults and disasters tell us?
Well, thank you for including me, and I'm happy to contribute to this conversation. The research tells us that one of the primary reasons there is such concern about this population is that they consistently experience disproportionate rates of disaster-related morbidity and mortality. So that is, they tend to become more ill or injured more often during a disaster or in its aftermath, or to perish in a disaster. So they do face disproportionate vulnerability, and that leads to extremely poor outcomes. But in discussing this, it's important to acknowledge that those vulnerabilities are not innate, right? They're not a result of the embodied experience of aging itself, but rather there are factors and living conditions that are common to many older adults, but affect particular older adults. So for instance, poverty places many older people in unsafe conditions that can cause danger and can lead to harm through increased exposure to hazardous conditions, through limiting their ability to cope with damage. And we see this as as an extension of the fact that workforce participation, for example, often declines as people age, and many people age without a financial cushion. Research has also shown that older people often struggle with the administrative burdens of a disaster assistance programs, which hinders the recovery process. And so we see that there are multiple factors influencing vulnerability in that capacity. There's also health concerns and mobility impairment that can leave older people more vulnerable to extreme conditions. And that directly links those concerns about morbidity and mortality, higher rates of chronic illness, and medical needs that can worsen due to increased strain and lack of access to care during times of emergency. And then also social support. We know that social connectedness is really important for accessing support and assistance during disasters, but many older people face social isolation in their communities, and that can have really negative consequences during emergencies by limiting the ability to access help when they need it, and also because the degree of social connectedness can link to people's physical and mental health. So those are some of the top contributors to vulnerability among older people. And we see that those are linked to each other as well. But again, I think it's really important to acknowledge that these conditions do not affect all older people uniformly. This is not a monolithic group, although they're often discussed that way. And just like other age groups, older people occupy different positions in our social stratification systems, right? So age is not the only characteristic that defines them. And those factors that shape social privilege and marginalization then also shape their disaster outcomes. So for instance, members of the LGBTQ+ community are more likely to live in isolation when they're older. So there's a need to understand and appreciate those intersecting identities. This is something that I've seen in the research as well that that often goes unacknowledged, and also that there's a need to consult with older people in research, which is something that's often missing from the discourse. A lot of the research talks about older people without speaking to them. And that's a problem with many populations, but I think there's a pervasive tendency to infantilize older people in the research discourse. And so that's some of what we've seen there too. And so that's one area that I think that we could explore further and look forward to discussing as part of the conversation.
Yes, thank you. And I think we will certainly get into that inadequate consultation, I think, in research, and as we'll find from our discussion going forward, not just in research, but in other areas across all of our panelists' work as well. Thank you for that background and helping setting the stage. Jeffrey, let's move to you. In Ventura County, California, you all there have endured multiple wildfires, severe storms, earlier this year, and a pandemic in recent years. What have y'all observed about older adults' experience in disaster?
Yeah, thanks, Austin. Again, I'm happy to be here, and I'm really thrilled to follow Dr. Campbell because her comments are so spot on. I'm putting two hats on to this answer. One is my current hat in philanthropy, but I was also the community development director during the Thomas Fire in December 4th of 2017. So I was on the front lines of those impacted and those trying to sort of figure out what the path forward was. And I think what we learned at that stage of that disaster was that, as Dr. Campbell said, not every elderly person is the same, and their ability to respond and have some resiliency to that disaster varied completely across the board. I recall there was an older woman in her 80s lived alone who decided to rebuild the house she lost, and you might imagine that you wouldn't expect somebody at that stage in their life to want to go through the rebuilding process, but she did, and she was able to make that happen. Unfortunately, she passed away right after the house was built, but she had this incredible drive to move forward, and she had the sort of the network around her to help her make that happen and realize her dream. But not every adult has that sort of support network. Either they have it, but they're not local because their family is elsewhere, or they don't have it at all. And they often are going through this in isolation and don't have the kind of the support of their family around. And I think that's something we've learned a lot as well. I mean, there's the sort of the, what you expect is not, they don't, maybe this population doesn't communicate the same way. So a text campaign to warn people of a disaster might not be as functional as for them. And so we have to accommodate that. But I think back to Dr. Campbell's last point and the comment, Austin, you made, I don't think in this community and in my experience in Ventura County, we've engaged agencies that service an older population in the planning for the future disasters and how we're going to respond and recover from them. So we did a whole gap analysis of our experience collectively in Ventura County through the Thomas Fire, and we really heard that there are lots of vulnerable populations that were not engaged, were not adequately part of the planning for disasters, and therefore were not they didn't have the access to information and didn't have the focus and resources that they deserved because they weren't part of the pre-planning of disasters. So, and we'll talk a little bit later in this webinar, but I think that's where we're beginning to shift as a philanthropy organization in town to say, we have to make sure that these organizations that serve this population, among other vulnerable populations, have the capacity to turn and provide these services when a disaster strikes. As we all know, our nonprofit agencies are sort of at the verge of collapse sometimes. They're really pushing themselves to the edge of capacity. And then when a disaster hits and they have to add more capacity to provide additional services, it's almost impossible for them to do that. And when that happens, the people they're serving are not getting the services they deserve. So I think that's some of the big lessons learned from our experience, both in that fire, the fires we've had since, the pandemic, and the floods we had earlier this year, I guess.
Yeah, you all have really been through it, and just want to express solidarity with you and your community and everything that you have endured. But thank you, Jeffrey, for that perspective. And the place-based foundation role is so important, and because you're so rooted in community, and appreciate that perspective of older adults and what you're seeing in your community. Let's move over to you now, Carol. Welcome into the discussion. The Horn of Africa continues to experience the longest and most severe drought on record, and millions face acute hunger. How are older adults being impacted by these drought and hunger crises?
Thanks, Austin, and it is a pleasure to be part of this discussion and to be part of this panel. And before I give my response, I just want to reinforce what Nenia said, her message of recognizing the intersectionalities when it comes to issues of older people and failing, or rather stopping from looking at older people as a single homogeneous group. And to also say that the consequences of normalized exclusion and lack of attention to structural failures that place older people to the periphery in the development discourse play out very, very starkly in the humanitarian crisis. And so if we're to look at the Horn of Africa, this is very true. The Horn of Africa has been where the drought is biting the most, has been neglected by the governments in those countries. Northern Kenya, Southern Ethiopia, and Southern Sudan have been neglected by the respective governments over long periods of time. And this is now playing out. The fact that older people are not taken into consideration in the planning, the budgeting, and the development discourse in those countries then plays out in the crisis such as what we're facing currently. So if you look at the statistics, 73% of older people in Kenya, Sudan, and Ethiopia do not have access to enough food. That's true for Ethiopia. They don't have enough access to adequate food. 56% of the population is eating 1 meal a day, and some are not even getting that. In Borena, in Ethiopia, which is a pastoralist community, 75,000 cows have died, and this is as at last year. And we have families that have lost entire herds and therefore losing their livelihoods. In Kenya, an estimated 1.4 million animals have died in the drought in northern Kenya. This is a pastoralist community again, and so their means of livelihood is completely wiped out. And in May 2022, when we collected this information, 80 people had died, 3,500 families displaced in just one area, Kapweta East, in the North County of Sudan, South Sudan, and they lost 11,500 cows, 2,500 because of drought. Others were because of cattle rustling, something that the governments have totally ignored. So if we move on to the next slide, we see then that in terms of the crisis, the primary care of children rests with the older people. 85% of the refugee populations in these countries have been left to take care of children, something that they were not doing. That is the older people. They're separated from their families in internal displacement or refugee situations. Where there are meals, you find that they often give up their chance to eat for the benefit or for the advantage of the younger relatives. They're excluded in emergency nutrition interventions, especially in the phases of emergency and famine, whereas they should be included in the discussion so as to know how to respond to their needs adequately. As a result, they receive emergency food aid that is not tailored to their need. Older people need a higher proportion of protein, but because they're not included in the planning for the interventions, you find that they get a lot of starch and sugar-based foods and not the protein that they need. And again, UN agencies and NGOs have adopted this blanket one-size-fits-all approach. And this, I think, needs to change because we have to look at older people in all their diversity. And also, we have widespread closures when we have crises. disruption of health facilities, reduced access to essential medication. For those with non-communicable diseases, they're not able to maintain their supply of medication. And this, on the medical side, I dare add that the systemic failures in the health systems just play out so starkly in the crisis. And so there's need to look back, to step back and start including older people and their issues in the humanitarian crisis stage, in the pre-conflict stage, so that when a crisis happens, then we do not end up losing the number of older people that we're currently losing. I'll stop there for the moment, Austin, and continue the discussion further on.
Thank you, Carol. You know, the severity of the hunger crisis in the Horn has been a key focus for CDP, and I appreciate you providing us a lens into what the impacts on this population are there. And it's also interesting already seeing across different contexts and geographies and cultural contexts as well, this idea around exclusion, inclusion, and how that's consistent. Thank you so much. Nania, I'll be coming to you next, but you know, just a quick observation to set up the question that I want to ask you. I had the privilege of attending the Peak Grantmaking convening this week, and in the final keynote panel, Travian Shorters said, "We are taught to label people by their need. We're taught to label people by their need, and not their assets and contributions." That was a message to philanthropy, but it really stuck with me, and I think it is certainly relevant to our discussion. So Nania, now that we've talked about some of the impacts of disasters on this population, what contributions do older adults make in disaster preparedness and recovery?
I love that this is an area of focus with this presentation and the other meeting that you were a part of, because I think this is one of the most overlooked issues in the research and other areas involving older adults. So I think that, you know, it's really important to not get bogged down in just discussing needs. I think that those are really important, but I want to emphasize, if nothing else, the idea that vulnerability is not simply the polar opposite of resilience, and that those two things can often co-occur. So they're not mutually exclusive. And so focusing so myopically on the needs and vulnerabilities that older people face, we really ignore those examples of how to support their resilience. And the fact that often people who've gone through a lifetime of hardship have developed coping strategies and perspectives that help them be resilient in the face of hardship. And there are important contributions there and important lessons that we can learn from those experiences. And so I think that's one important area to focus on. That's particularly true of older people who have been socially marginalized. And so they're often people who have managed to have learned how to manage adversity. And those are important lessons for us to engage in, engaging those people so that we can, those folks that we can learn from those experiences. But additionally, moving just from our own learning, I want to emphasize how older people can contribute importantly to community resilience as well. Many of those examples also fly on the radar because, again, we're not used to acknowledging the capacities and contributions of older people. But there's a few examples, and there are many, well, there are many examples, but there are a few that I just love to share that I've come across in my own research or read in the research literature. One important point is that retirees contribute a lot of volunteer labor and often provide a lot of important disaster-related support. And I've had the opportunity to be in research teams looking at some of these examples. For example, retired senior volunteer programs that have and we've seen engage older people in disaster preparedness, response, and recovery activities because they had the spare time to do so. Again, not everyone has that capacity. Not everyone has the time to be able to retire and the wealth to be able to do so. But these kinds of programs that do offer that pathway to volunteer opportunities are really important. We've observed examples of retirees doing things like managing construction teams in post-fire environments, making go bags. During the COVID-19 pandemic, I think many of us saw retired nurses and medical personnel reactivate to augment medical workforce capacity, medical response capacity, even sewing clubs, right, making masks during the mask shortage early in the pandemic. So again, not all older people can afford to retire or to volunteer their time, but we do need to recognize that among those who do have the time to do so, that represents a really significant untapped resource with a lot of people who have these skills they've developed over the course of their lives and time to contribute to their communities. Another example I really like to share is from the 2013 floods in Colorado, where several of the mountain communities were cut off from the outside world. This was a really intense storm event that took place over several days, and the communities in the mountain areas in Boulder County in particular became isolated, and that resulted in the largest air evacuation effort at the time since Hurricane Katrina. Part of that response effort involved the Mountain Emergency Radio Network, among other mountain radio, ham radio clubs, and that were started largely by older adults living in the mountain communities following a previous wildfire in which they had really negative experiences with trying to get evacuated and wanted some more control over access to information, knowing that cell phones and other forms of communications don't often work. Those mountain ham radio networks served as an important backup for emergency response when other communication methods failed. They were instrumental in facilitating the evacuation of a group of school children and their chaperones who became trapped in the mountains because they had these older people in the mountains who knew the terrain and had this access to this communication and were plugged into the emergency management system in a formal way. Another example that I really like is from Japan following the 2011 triple disaster, the Ibasho Cafe. This is the image that you see on the bottom right-hand corner as an illustration in relation to this concept. And that was constructed in the city of Ofunato after that area was devastated by the earthquake and tsunami. And the concept was really one where an acknowledgement of these disproportionately negative outcomes we often see among older people. The term Ibasho references a place where one feels a sense of belonging and purpose and is accepted as oneself. And so the cafe aim to facilitate that to foster that sense and to engage elders as essential contributors to their community's social capital and its community and the community's resilience in the aftermath of that disaster. It provided an outlet for older people to build this community space that played a really meaningful role in the recovery process. So it was designed both to acknowledge elders as valuable assets to their community and also to empower them to be active participants then in changing the harmful outcomes of society's negative perceptions of aging that often leads to their exclusion. And again, this contributed really meaningfully to the recovery effort. There are many other examples I could go on and on, but I just think that it's really important to acknowledge that on an individual level, that resilience that can be there, that we could support rather than only focusing on the needs, which are important, but then also going beyond that to expand the contributions and our imagination about what older people can contribute to the community.
Yeah, thank you, Dr. Campbell. And if you're not familiar with the Ibasho Cafe, I encourage you to look more into it. It's a fascinating model and approach. And I just, love your example too of the ham, radio operators in the network, because it's not just, the passive recipient nature, I think, that we're often put on older adults, but that is an example of people with existing capacity and knowledge being proactive in actually accessing information for themselves and helping their community. So thank you so much. Carol, let's move back over to you. So in complex humanitarian emergencies, which often have very different time horizons than sudden onset disasters, such as a flash flood, for example, what does successful recovery and increasing resilience for older adults look like in that context?
Thanks, Austin. And again, I will reinforce some of the examples that Nenya has given and use that as a good segue into what I'm going to say about data, because the examples she's giving sit with our communities, but they're hardly ever documented. They're hardly brought to the table in terms of disaster response mechanisms or even mitigating disasters that we're able to. So it is very, very important that we have data that is disaggregated on the basis of sex, age, disability, under the SADD approach, that sex, age, disabilities, disaggregated data approach, so that we use this in needs assessments to ensure that we include older people in problem solving, but also promoting solutions that speak to their dignity and well-being and give them a voice. And that speaks to what Nenia has just said about their capacity to engage in some of the response mechanisms. So if we give older people a voice, they're able to step up. And we've seen it in several of the examples that have been given. So for us, that is really, really primary to the work that we do for recovery and for increasing resilience. But we've also worked on developing tools and guidelines, such as the humanitarian inclusion standards, to ensure that no one is left behind at every stage of the emergencies. And this is across food, wash, livelihoods, shelters, and NFIs. We've also worked with the idea of seconding humanitarian aid inclusion specialists into the global protection cluster and into the protection cluster at country levels. And we have some of our specialists who lead age and disability working groups. And maybe just to say a little more there, that when we work well in coalitions through these clusters and working groups that exist pre-crisis, it's very easy to lend our voice and bring our expertise in the post-crisis or even during the crisis in the response. And we also have sector-specific age-inclusive interventions, including home-based clear outreach approach, cash transfer, value for older persons, dignity kits, assistive programs and treatments for non-communicable diseases. And then if we move on to the next slide, some of the lessons or some of the challenges and attitudes that we need to stand up against is the ageist attitudes, because a lot of what we've been saying about excluding older people amounts to ageism, and we must tackle those ageist attitudes, because we've seen that older people are disproportionately affected. They're able to bring something to the table, but they're excluded, they're marginalized simply because they are older people. So we must recognize the diverse experiences of older people, particularly those who are marginalized or at risk. If we speak about the drought in the Horn of Africa, this is not the first time it's happening. And so communities have the historical knowledge of how they handled some of these issues. And those who would sit at the center of that history are the older people, but they're not consulted, they're not included. And then we also have to disabuse the misconception that all older people are cared for by their families. This is not always true. In fact, many times older people are neglected or abandoned, at times willfully and at times by default, when younger people move on to look for alternative sources of livelihood and moving away from what they knew. And this is true in the Horn of Africa. Younger people have moved away from pastoralism, gone into towns and cities, and left their children with the older people to care for them. So it is the other way around. It is not the older people who are being cared for, but older people are caring for entire families. But we have also failed to acknowledge and recognize the abuse of older people within family settings. This happens pre-disaster, and it's actually exacerbated during crisis. And this is totally left out and ignored in all the arrangements, in the response, in the discussions around post-crisis arrangements. The issue of abuse of older people is totally left out of the equation. And there's also the misconception about the homogeneity of older people, and this we spoke about, so I'm not going to belabor the point, but this is something that we also have to tackle because it comes from the place of ageism, where ageist attitudes then inform how communities, governments, NGOs respond to older people in humanitarian settings?
Thank you, Carol. I think you saw all of us kind of like nodding. It's like the virtual Zoom version of doing the snaps or like the clap if we were all together in person. There's so much there that we could unpack, further, but I just want to call out, what you mentioned about through the age inclusion specialists, the work that we can do as funders and the people that we support and our partners before a disaster happens, right? It's the onus is on us to act now, not just wait for something to happen. And I love that you picked that out and also demonstrated the way that HelpAge is trying to get ahead of the curve and ahead of the disasters in that way. So on that kind of preparedness and thinking ahead mindset, Jeffrey, let's go over to you. Your foundation, which I should mention is a member of Grantmakers in Aging, one of our co-sponsors, is shifting towards investments in disaster preparedness. Can you share why this shift and what you are doing, especially as it relates to older adults?
Yeah, absolutely, Austin. I think it's clear, having gone through our share of disasters over the last 5 years and our role at the foundation, frankly, we weren't in the disaster response business until the Thomas Fire hit. And then we sort of jumped in with both feet and have stayed there for several years, and hope we have a break before the next one. But what we learned through that process, and I think we've all learned through that process, is our nonprofit service providers in particular were stretched and were not prepared to respond to that disaster and didn't have the capacity to do the work. And frankly, their experience even through COVID was lots of money came in through COVID for all folks to provide services or to have relief or to bridge funding to keep themselves going. But now that money is starting to dry up, and those organizations that maybe felt a little flush for a few years are now worried about where they go from here, because that money came in and went out in services. They didn't build up reserves for the next rainy day through that process, because it was important to get the money out the door. And so I think many of our nonprofits today are worse than they were before the COVID disaster experience, because they're back to where they were, they're exhausted, and they really haven't had time to plan for the next disaster. So in our mind, we all know as funders, it's largely easier to raise funds immediately following a disaster. Because especially if it's localized, because the whole world is paying attention and money tends to flow, and it's a pretty good time to raise money for that purpose. But as the disaster moves to later stages, that becomes much harder to do, and that's been our experience. And I think one of the best pieces of advice that we got early on was and this came from FEMA. That these disasters expect to be in the disaster mode for 10 years after the disaster. And that's been our experience. Is we're 5 years plus into one, and we still have folks that have been impacted or have not come back or got their homes rebuilt. And I'll talk about that in the later slide in more detail. But so what we did at our foundation is decide that we're even though it's harder to focus on the future, but we decided we have a moment here where we can actually have fresh experience from disasters. We have community partners that want to be better the next time, and we had the ability to bring some funding to the table with a couple of our California partner funders, Wells Fargo and Southern California Edison, to give us the ability to think about the future. So we've brought expertise in disaster response to the table, and our goal is not, the audience of this work is not the individual. The audience of this work are the service providers, and particularly those that serve vulnerable populations like the elderly, to make sure that they have the tools themselves to be able to pivot the next time a disaster hits. Fires have been terribly disastrous to our community, but we're on the verge of probably having an earthquake at some point in the hopefully distant, but maybe soon future, and that will be much bigger and much more broad of an impact to our community. And so, how do we prepare for that? So, our goal in this work, as it's described on the slide here, is really talking about how do we make sure those organizations have the capacity to be resilient the next time there's a disaster. If they're strong, they have the ability to provide provide services above and beyond what they do on a daily basis in the non-disaster blue sky time, they'll better be able to help those end users, particularly those that are vulnerable populations. So we are in the process of developing sort of what we're calling sort of an MOU with each of our nonprofit partners. We started with a cohort of partners that we know have been good partners in the past disasters and have the best chance to sort of set us off in a strong place. And these are partners like Area Agency on Aging, Senior Concerns, the Camarillo Healthcare District are all agencies that we want to support through this process. And these are all elderly focused organizations. We're covering all populations, not just the elderly, but our goal here is to make sure these agencies have the basic tools. And I think on top of that, they have the minimum standards of performance and readiness, so that when the disaster hits and we have money coming in our doors to go back out to the community, we're giving it to the organizations that we know are most ready to take those funds and use them. And so there is some risk, because we're going to end up with some haves and have-nots. If you are a partner that's met those minimum standards, you're on our yes, we'll fund you list. If you're not, you might not be the emergency funding partner that we choose. But we really believe that's important to make sure that the money goes out the door to an organization that's able. In fact, we gave a significant grant to the Salvation Army during the COVID vaccine, and they ended up giving half of it back to us. Which I don't think has ever happened in our history, because they didn't have the capacity to get the money out the door. And so we want to make sure that we're only picking those that have the history and a capacity and have the tools in place to take those funds and make them available to the end users immediately. And our hope is to have those in place over the summer. And we're testing it. We're not imposing those standards on the organizations. We're actually going to them and saying, what was your experience last time? Where did you fail? Where could you have used some help? What kind of challenges did you have? Was it staffing, funding, facilities, storage, and making sure that we have a plan to help them fill those gaps and they're ready to go the next time. I think the other strategy that we think this is helpful for is if we're focusing our energy to those that have the best impact on the community, we're going to have a better impact on the recovery with those partners. And as you know, in disasters, oftentimes we have these pop-up organizations that come up to fill a gap. We want to actually know that there's a gap that needs filling before we find an organization to fund that might not have existed before the disaster, because then they want to stay in existence going forward, and we have yet another nonprofit that's kind of barely able to provide services. So it has some challenges to make sure that we pick the right nonprofits, but we think we have good experience over the last 5 years, and we will do that.
Yeah, thank you. And we always love to hear examples of funders modeling for the community and for other funders the importance of investing before a disaster. And thank you for those examples. So we are going to go into one more question each for our panelists, but I want to remind our attendees not to forget to put your questions in the Q&A box. I see many are coming in there as well. And just to our panelists, as we go into this last question for each of you, if you could respond to it quickly so we have time to answer some of those questions, that would be greatly appreciated. Nania, let's go over to you. What is your message to funders? What should they consider when supporting disaster recovery with this population?
A few things, and I'll try to be concise. One thing, going back to the examples I shared earlier, ignoring the capacities and contributions of older people is a problem, recognizing that we're sitting on an untapped resource here. So we need to find ways to open the tap, create those opportunities to better engage communities and clubs of older people and bring them formally into the disaster planning process and to response and recovery plans. Also the need to, just going back to last month's webinar on disabilities and disasters, bringing back this notion of nothing about us without us is important to keep in mind. Moving away from this model of talking about older people without consulting with them is really important. I think that's especially important in light of some of the themes that Carol brought out in her remarks about older people facing abuse in family and other settings. And then also strengthening those connections to emergency management. Disaster planning really needs to account for the vulnerabilities and unique needs of older people, as Carol mentioned, those nutrition needs, medication, healthcare needs, but also to move away from that deficit thinking and build on those capacities that they have and the contributions that they can make. Genuinely engaging older community members and senior serving organizations. And then really want to echo everything that Jeffrey said about building capacity. This can't be a matter of one-off projects, maybe, individual collaborations. Really, there's a need for bringing organizations that serve older people into the fold, building and sustaining partnerships and connections with emergency management, with disaster planners of all varieties, and particularly engaging those organizations serving the most vulnerable members of our older communities. Again, explicitly acknowledging that we're not talking about a single population and that we need to really target resources and support for capacity building, especially to those organizations that serve marginalized older adults, folks who are undocumented, and often that causes issues with accessing support during disasters within Black and Brown communities within the United States, recognizing that those organizations in particular serving those communities, representing those communities, often face unique challenges and are less visible and are not engaged when we're having these conversations about what organizations to bring into the disaster planning process.
Thank you, Nadia. So many wonderful points for funders to chew on. Carol, a similar question for you. What is your message to funders who want to support older adults in disasters and humanitarian crises? Oh, I'm sorry, Carol.
I didn't think, I didn't think that would happen here. Yes, I'd like to start by saying something that has become almost a clarion call for me, is that aging, all of us are aging. And if you're young in this webinar, you're an older person in waiting. And aging is cool. After all, everybody's doing it. Somebody said that, I don't know who did. And because we are living in a rapidly aging society, the population is rapidly aging, that's a fact. I think we cannot ignore the issue of aging in humanitarian crisis. We've seen Ukraine, the war in Ukraine was a foretaste of things to come, given what happened to people over 60 in Ukraine. So after climate change, it's population aging, it's the most significant macro issue today, yet it's the biggest blind spot for governments and international communities. So we must pause and reflect on that. And therefore, there's need to support the SADD approach as a standard practice in UN and NGO sector, because many times we get data only disaggregated on the basis of gender and even on the basis of sex. And even then, it does not give the nuances that surround the sexes, the male and the female. So we need to go further down and break it, especially with regards to age. Let it be a standard practice. There's also need to fund the expansion of age and disability working groups. At HelpAge, it's our goal to have a full-time humanitarian age inclusion specialist seconded in every country with an active disaster. If we just pause and look at the disasters, the crises around the world today, they're more than the fingers on both our hands. Ideally, it shouldn't even be the fingers on one hand. But if we just stop and look at the crises, we have so many crises and they keep increasing. And therefore, there's need to look at age and disability working groups. And if I may add, to also bring in the intergenerational perspective, because we have a lot of youth. In Africa, we have a youthful population, which is going to age, is aging, not going to age, is aging, and will reach the older person's definition at a go, and we won't be prepared to deal with the issues that will affect them. And if there's a crisis that happens, as is wont to happen, then we have a big problem in our hands. There's also need to fund research for more evidence on the exclusion of older people in the humanitarian system, and flip it around so that we have evidence that enables older people to participate in the humanitarian system from pre-crisis, during, and post-crisis. And there's also need to fund age-inclusive humanitarian programs and support projects that focus on promoting participatory approaches, intersectional, and that last part is and intergenerational action, because that is the only way we'll be able to cover the crisis in how it reflects. We've talked about younger people leaving their children with older people. Unless we address it from the crisis from an intergenerational perspective, we won't be able to deal with some of those dynamics moving forward. So that would be my call. And to repeat again, we are in an aging society, so it's important to take the issues of aging into consideration.
Thank you, Carol. We are all aging, as you said, and aging is cool, isn't it? I agree. Jeffrey, let's wrap up with you and then move into a question or two. What learnings from engaging with older adults and supporting disaster recovery would you like to share with other funders who may be interested in working with this population?
Sure. I just throw this as an example of the scale of the fire and the impact on our community in 2017. And this is Marcy. I won't spend time telling her story in detail because I think we've heard many stories that reflect her experience, and I won't repeat that. But from lessons learned, I would say a few things, some of which we've heard already. Our aging population, they're not just victims, they're also resources in the recovery process. And I think that's a really important point to make. I know we found, even with COVID, like our food share organization, most of their volunteers before COVID were elderly. And they couldn't be engaged given their potential risk from COVID. So they lost volunteers during the disaster because their elderly population were largely serving that role. So I think that's something that really pay attention to. The networks of our elderly population, making sure that there's opportunities for them to have networks and support around them, particularly if their family is not local. I think the value of philanthropy is much bigger than the checks that we write. And Marcy is a good example. She has been so appreciative. And just her stunning and emotional response to us awarding her money to help her finish her house has been really important. I think she's all alone. And we have become part of her family by helping her finalize the construction of her house. We've said it all, and we have to engage the elderly population and those that serve them in disaster planning to make sure that their voice is heard and their issues are addressed. And then I think finally, this is something that I thought a lot of in the early stages after the disasters I've been part of, is disaster recovery is hard work. It's emotional work. And the organizations that are doing that work, their staff need to be supported as well, because they're on the front lines dealing with people at the worst time in their lives. And you can't do that day in and day out and without having your own sort of emotional challenges. And so we have to be careful about putting people on the front lines for too long, because we'll have more victims from the disaster, because that's hard work for them to do that work. That's my thoughts.
And thank you for just recognizing the power of philanthropy, both in our financial resources, but all of our resources, and mobilizing all that we have in order to do this work. Thank you to all of you. Looking at the time now, unfortunately, we won't have too many time for questions, but we are going to focus on a couple that have come up. And I think some of you have addressed pieces of this in terms of naming it. But I see a question in the chat, and Nanina, Dr. Campbell, you read my mind on this question as well. I was going to send it your way. And I think it's a really important thing to recognize. We've talked a lot about the older adult population. Obviously, it's the focus of this webinar. Some of you have mentioned intergenerational approaches and activities, right? So there's a question in the chat, do the panelists see a role for involving the youth? And Nanina, I'd just like to send that over to you and get your thoughts on that.
Well, thank you. Yes, I'm excited that this question came in. And I think that is an important piece of this, both in terms of, just building those connections and finding different approaches, but also as a longer term investment in addressing the stigma against older people. I think it is really important. And Carol mentioned this as well. Bringing those intersectional approaches and intergenerational approaches to supporting projects that do that have that as a core component. There have been a lot of examples of projects, for example, that engage children in planning and thinking around disaster issues, disaster planning and mitigation. Bringing those populations together, youth and older adults, I think is a really great way to do that. I'm involved in a research project right now with some collaborators, a Life in COVID study, where we have youth and children doing podcast interviews with older adults reflecting on their experiences with the pandemic. I think more projects like that can put different generations of people together to work on issues, to reflect and to empathize with each other's experiences around disasters and thinking about how we want to respond to disasters, what's important for us, is a really important way of bringing in new perspectives and also building that support and that interest in engaging and that respect that's really necessary to move forward on all of our issues with not acknowledging both of those populations across the age spectrum.
Thank you very much. Yeah, I love the power of intergenerational activity and shaping and reframing, the future generations and current generations' mindset around this population. I see more questions, and I thank you for those. I also see some comments just about the work that each of you are doing, and just kind of giving some shout outs and a bit of praise as well. So this is really it takes a village, and certainly in terms of this work. And so I appreciate all of you and the work that each of you are doing. And I recognize some of those comments in the Q&A as well. Unfortunately, that is all the time we have for questions today. But as we begin to wrap up, I want to provide the audience with some actionable thoughts from our conversation. First, work to end ageism. We've talked about age. Carol brought that up today, and we have all been talking about that. Ageism and stereotypes about older adults are pervasive, and they negatively impact all of us. But together we can change this. For more information about ageism and resources, such as some guidelines for age-inclusive communications, I want to give a shout out, encourage you to visit Changing the Narrative, a campaign of Next 50 Initiative, another Grantmakers and Aging member. Second, practice inclusion. As we've learned today, older adults are often excluded from programs and initiatives that actually affect their lives. So look and see how older adults see older adults as a resource rather than a liability, and utilize their knowledge and their capabilities. And thirdly, invest in older adults to meet the needs and desires of this growing population. More resources from philanthropy are certainly needed. Older adults and organizations that work with them have plenty of knowledge and capacity, but they need your continued partnership and investment. If you are a funder, Grantmakers and Aging is certainly your go-to network and resource. You can find many resources that can assist you on CDP's website, from our issue insights, our disaster profiles, disaster philanthropy playbook. We provide numerous resources for those planning disaster funding. Our team is always available to provide guidance. If you need more in-depth assistance, we also provide various consulting services, and you can find more information about our work at disasterphilanthropy.org. Our next webinar will be on June 8th at 2 p.m. Eastern Time, and the focus will be survivor and community-led response. Please visit our website to learn more and to register. In order to respect everyone's time and to keep this to an hour, unfortunately, that is all the time we have for today's webinar. Thank you so very much to our co-sponsors and to Carol, Jeffrey, and Dr. Inia Campbell for taking the time to share their insights with us. Please take a moment to complete our post-webinar survey to let us know what you liked and what you would like to see in future webinars. It will pop up automatically when you exit the webinar. If you have any questions or thoughts that were not addressed during today's webinar, you may email them to Tanya at tanya.gulliver-garcia@disasterphilanthropy.org. Thank you all again, and have a wonderful morning, afternoon, or evening, wherever you may be.